Diabetic retinopathy. Today, we'll review what this diagnosis means, common clinical considerations, when a provider query may be appropriate, and key care planning concepts for skilled nursing residents. Diabetic retinopathy is a complication of diabetes that affects the blood vessels of the retina. Over time, high blood sugar levels can damage these blood vessels, causing them to leak, swell, or become blocked. As the condition progresses, vision may become blurred, and in severe cases, permanent vision loss can occur. Diabetic retinopathy can affect vision, safety, daily function, and overall quality of life. Residents with diabetic retinopathy may experience blurred vision, decreased visual acuity, difficulty reading, or trouble recognizing faces and objects. These vision changes can also affect daily function. Some residents may have difficulty managing medications, navigating their environment, participating in activities, or completing everyday tasks independently. So why does this diagnosis matter? Diabetic retinopathy can affect many aspects of a resident's health and daily life. It may impact vision, safety, medication management, participation in therapy and activities, and overall quality of life. It can also increase the risk for falls and injury. So when should we consider a provider query for diabetic retinopathy? Start by asking yourself 3 questions. First, does the resident have diabetes and evidence of retinopathy? Second, is vision impairment affecting function, safety, or quality of life? And third, is the condition being monitored, treated, or care planned? If the answer to these questions is yes, and the diagnosis is unclear or has not been documented, a provider query may be appropriate. Let's look at an example. In this case, the resident has type 2 diabetes, blurred vision, difficulty reading medication labels, increased supervision during ambulation, and ongoing ophthalmology follow-up. Documentation also reflects retinal hemorrhages and diabetic eye disease. Based on these clinical indicators, the impact on daily function, and ongoing monitoring, a provider query may be appropriate if diabetic retinopathy is not clearly documented or established by the treating provider. Once diabetic retinopathy has been identified, there may be several interventions in place to support the resident's safety and function. Depending on the resident's needs, these interventions may include vision monitoring, diabetes management, ophthalmology follow-up, environmental modifications, adaptive equipment, and fall prevention measures. The goal is to support safety, maintain independence, and promote overall well-being. Now let's look at a sample care plan framework. As you review the example, notice how the care plan reflects the resident's vision impairment, safety concerns, functional needs, and diabetes management. Remember, the goals and interventions should always be individualized based on the resident's specific condition and needs. As a final takeaway, remember that diabetic retinopathy is more than an eye diagnosis. Ask yourself 3 questions. Does the resident have diabetes and evidence of retinopathy? Is vision impairment affecting function, safety, or quality of life? And is the condition being monitored, treated, or care planned? If documentation is unclear, a provider query may be appropriate. It's also important to remember that under PDPM, diabetic retinopathy